This is Radio Health Journal. I'm Reed Pence. This week, why experts think Omicron could end the pandemic.
Perhaps we could transition from pandemic to endemic. That is, a truce that we have with this virus.
And it could mean a normal summer when Radio Health Journal continues.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
What's really cool about Amy Boardman is you may not know her name, but you know who she coached, Simone Biles.
Examining the legacies of the coaches who crafted the best athletes in the world. Then,
as a female, she's not afraid to be who she is. She recognizes that she's equal to everyone else. She's not waiting around for someone else to solve the problem. She's out there ahead of it.
The modern appeal of fictional characters like Hermione Granger. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
As the COVID-19 pandemic enters its third year, it's easy to wonder if life will ever get back to normal. We've had false hopes, last summer, for example. But then the Delta and Omicron variants arrived, and infections rocketed to record levels. Hospitals once again were overflowing. COVID has now killed more than 900,000 Americans. But public health experts say some of these gloomy statistics actually reveal a way out, and restrictions are starting to ease up. Dr. William Schaffner, professor of infectious diseases and preventive medicine at the Vanderbilt University Medical School, says experts now believe that the pandemic may be over far sooner than you might have thought.
My fingers are crossed because I hope they are correct. The notion being that Omicron spreading so widely will actually create a level of natural immunity, which if we added to all the people who've been vaccinated, and there will be some overlap, but between the two, perhaps in the next 4 to 6 weeks, we could see Omicron trending down in new cases, followed by hospitalizations, followed by deaths, and perhaps we could transition from pandemic to endemic. That is, a truce that we have with this virus. It's not going to disappear. We'll have to continue to cope with it, but at a much lower level, allowing us to return to some semblance of normal life.
The key is Omicron, the scary variation of COVID with rampant transmissibility. Starting in December, within just a few weeks, Omicron came from nowhere to account for 99% of COVID cases in the U.S. It's still dangerous because it's so contagious, but it's also far less lethal. And Dr. Ian Gonsenhauser, Chief Quality and Patient Safety Officer at the Ohio State University Wexner Medical Center, says that combination could lead us out of the pandemic.
We were all, I think, very pleasantly surprised to see a variant that was extremely competitive with other variants, meaning it was more transmissible and more contagious, so it could outcompete its other variants that are competing for the taking over the population, if you will. That's what viruses really want to do. They want to win. And this is a virus that appears to have won in that 99% or greater of all worldwide cases are the Omicron variant. And at the same time, less severe than prior variants. And so what that says to us, what that shows us is that this is the type of variant that can transition us into a more endemic phase of COVID, that more normal living with the virus phase.
Gonsenhauser says when public health experts see this combination, the question is no longer how do we keep from catching it, but something else entirely.
We begin to ask the question of what does that severity necessitate? If this is no more severe than the flu at this point, then can we treat it the same way as the flu? And once we see that start to happen, we can start to change our approach to testing, to vaccines, to mask use, to all of the precautionary measures. And at that point, this becomes kind of a normal bug that we just deal with all the time, like the flu, like common colds and other things.
That doesn't mean vaccination for COVID isn't important. It is. With a weakened Omicron variant, doctors say vaccination makes it much less likely for people to get really sick.
There's no doubt that if you have COVID infection and recover, you will have a degree of protection. There's no doubt about that. For how long it extends, we don't know, and we're not sure about how broad that protection is. That is, are you protected only against that variant, or do you have broader protection against other variants? Now, the other thing that we have learned is that if you've recovered from COVID and then get vaccinated, your level of protection is much, much higher. That higher level of protection, we think, will assure a longer duration of protection. And those antibodies that are raised by the combination of natural plus vaccine seem to be broader. And it looks as though in the laboratory, it certainly provides broader protection against a variety of different variants.
Infectious disease experts know that what we're seeing now is the natural progression for many viruses. A virus won't thrive if it kills most of the people it infects. A weak version that infects everybody is what viruses aim for.
Well, job one and job only for the virus is to infect as many people as possible. It doesn't want to kill you off because that's a dead end for the virus. It can't go beyond that. So, yes, I think this virus would like to, if we can think of it that way, infect as many people as possible.
This is exactly what a virus wants to do. It wants to find an incredibly transmissible variant of itself, preferably one that can be transmitted without even causing symptoms, where it's unknown, because then you have a long additional transmission period, to find a large body of hosts that it can replicate in and spread in. And if it's, killing its hosts or sending its hosts to the hospital very quickly, it doesn't achieve that. And so the steady state, the end point for a virus is to find exactly this type of situation. High transmissibility, low severity, can fly under the radar so that people can transmit it unknowingly, generally for days or even weeks. And then it perpetuates and will be with us likely forever in this reduced severity state.
Omicron is much harder on people who haven't been vaccinated. But for those who've had their COVID shots, Gunzenhauser says infection almost never creates a life-threatening illness. Instead, it's more like the flu.
And for those folks who are vaccinated, this variant represents such a low threat to your physical well-being, such a low threat of severe infection. We're seeing 20-to-1 unvaccinated to vaccinated in the hospital. So if you're vaccinated, there's very little risk of being hospitalized, of having significant long COVID symptoms, of having one of the potential complications or comorbidities, and certainly avoiding severe disease and death. So I think for those individuals, they recognize that decrease in risk, and they realize that they personally are safe, and that what we're really moving into now is circumstances in which only those folks who are not taking those actions to protect themselves are really staying in harm's way. And I think we've gotten to the point where people are willing to accept that we're all determining how we will experience COVID and what type of COVID we will have.
People choose with their COVID vaccination, or lack of it, how sick they'll get when they cross paths with the virus. COVID shots, masks, and social distancing are all good defenses, but they don't control what the virus does.
This really is a product of the virus itself and viral mutation and the way that mutation works. And it's a random process that we have really no control of. When it comes down to it, all of the things that we've done to try to manage and mitigate have really been attempts at addressing either the source control, the spread, or just the symptom of the infection itself, which is the widespread transmission, the hospitalizations, and even the deaths. So what we've done to this point has really not had any impact on the potential direction that a variant can go, either more or less severe, either more or less contagious. That is purely a product of random, natural selection and the evolution of the viral genome.
So does that mean another far more deadly variant could supplant Omicron and get us right back where we've been? Well, maybe not, though there is a new mutation called BO2 that some people are labeling a stealth variant.
That's in the UK, and it's just cropped up. It's a little bit different than Omicron. It doesn't appear, early days, but it doesn't appear to be so very contagious or so very serious at the moment. So it's kind of quiet over there in the UK, but they're watching it. It's labeled a variant of interest, but not yet, fortunately, a variant of concern.
There was one variant labeled BA2 that was an Omicron variant that showed some concerning ability to evade immunity, vaccination, and other treatments that we have. That has not had a spread. It has not taken root. It has not been able to outcompete the initial Omicron variant. And for that reason, we're not seeing it spread. I believe that Omicron is so transmissible and has such a significant competitive advantage over any other variant that we've seen thus far that I'm not concerned at this point about a new variant showing up.
If indeed we're entering a new phase with a less potent virus, Schaffner says for families, workplaces, and public health officials, testing will become more and more important and more a part of normal life.
Frankly, I was surprised at how enthusiastically testing was embraced. For a variety of reasons, people would like to know what their status is at different times. And so we're going to see testing become a part of how we deal with COVID. I think it will really play an important part as we get into endemic COVID. Can we visit grandma? What's the status in our school? So there'll be a number of different circumstances where we'll continue to want to test, even if Omicron recedes. And certainly to visit grandma if we're all vaccinated and boosted. But grandmother is 72 years old with diabetes. We want to be careful of her. Getting a test that morning before we see grandma for dinner that evening, that's a reasonable thing to do.
So what will life look like as we go into the spring and then summer? Both Schaffner and Gonsenhauser are optimistic. It's likely that periodic boosters will still be part of dealing with COVID, much like the annual flu shots many people get today. In fact, a lot of life with COVID will start to resemble the flu. Schaffner says our attitudes seem to have gotten there already. To most people, COVID is already not quite as much of a nightmare scenario as it used to be.
You know, familiarity breeds, if not contempt, at least a certain nonchalance or indifference. It happens with influenza, right? We accept annual outbreaks of influenza that really increase hospitalizations and deaths, particularly among older people, but flu is rather humdrum. I think we see something happening with COVID also. People are just saying, look, this is something we're going to have to live with, and we're going to accept a certain degree of individual risk. Of course, that equation doesn't really take into account transmission. It's all very well for you to take some risk, but you may be passing on this virus to others who get more seriously ill. And that's why we in public health are crotchets about this. We keep reminding people to wear their masks and do their social distancing. And by the way, get vaccinated and boosted, please.
Researchers have done their part. The blank pages we had on COVID 2 years ago in science books are full of knowledge today. And those who now contract this 21st century plague are far less likely to die than those who caught the coronavirus less than 2 years ago. But while scientists and exhausted frontline health workers have contributed greatly, Mother Nature has been the biggest player. She always is.
I think that the spread has been fast enough and the severity low enough that by spring, we're going to be having the spring that we've hoped for the past couple of years. I think that numbers will continue to decrease. They're dropping dramatically right now, as we've seen happen in other nations following their Omicron waves that preceded us. And I think by the time we're looking at end of the school year and moving into early spring, summer, we're going to see numbers back to very manageable levels. And we're going to start seeing many of these broad public precautionary measures and mitigation measures start to roll back.
You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
Kidney transplant is in fact a cure for end-stage kidney disease, and that currently the supply of human organs just cannot meet that need.
Are pigs the answer to fixing the organ shortage crisis?
Then how self-driving cars can be dangerous when sharing the road with human drivers.
How can we maybe change the algorithm to make the computer behave more like a human?
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.